The power of positive thinking impresses upon your mind the immediate desire to click the subscribe button. Now. Well, that makes sense because I am wonderful. Um, the thing with you, though, is you're legitimately someone who has stabbed me in the back.
Legit.
When whenever I bring your name up in and among other people, I let them know, like, you stabbed me in the back, 3 or 4 times, if I'm not mistaken.
Multiple times. In
Yeah.
fact, I'm known to be a person who stabs people.
Why?
It's part of how I carry myself. I like to be known as the one who inflicts pain in order to bring healing.
So your new name is Masso Chris.
You know, in my office, on the table, when people are being treated, they'll often scream the name of Jesus, and amongst many other curses. Um, and they've come up with a nickname for me because the name of Jesus gets sort of spewed out so frequently due to pain that they've started to call me Padre Chris.
Nice. Yeah. What?
So because they say that they say the name of Jesus in my office more than they do in any other place, so this must be some sort of church or confessional, due to me stabbing them in the back with little microfilament needles.
I think you've got a calling in your future. Um,
You never know. You never know, Mike. You never know, man.
what's the deal with microfilament needles? I mean, so just to, it sounded cute enough, but whenever I have a certain type of back pain, Chris has, stuck these needles in my back. It's not acupuncture. It's different in principle, and the tools. I assume the tools are different
The
than
tool is the
acupuncture.
same, actually, Mike.
Is it?
The needle is identical to the needle that is used in acupuncture. And in fact, many acupuncturists will actually say that it is acupuncture. And there's this big debate between physical therapists, chiropractors, acupuncturists, medical doctors on what this modality should be called. But for those in the Western scientific approach, they call it dry needling or um, or intramuscular manual therapy. So taking a muscle and taking a needle and putting it into a muscle in order to perform a treatment that produces a very successful outcome for people that have sort of acute pain or pain that has manifested for quite some time.
I noticed in my case, it's basically what you described. I mean, the pain didn't stop, the problem didn't stop, but the acuteness of it did, and so it opened up abilities, more mobility, that I didn't have at the time of the procedure. What's the principle behind it? Like, why do it?
So there's a few theories. Um, but the primary principle is basically, in layman's terms, it's when a muscle gets really tight. Muscles, by nature, when they get taut, they send what they call referred pain to a variety of different places. So, for example, the muscle in the back of the shoulder, right? It's one of the rotator cuff muscles. It's called the infraspinatus. And what happens when that muscle is really tight, it can actually refer pain to the front of the shoulder and down to the fingers. So oftentimes people, when they have tight muscles in the back of the shoulder, they'll think it's a herniated disc. And it's often misdiagnosed. And in fact, that's just a tight infraspinatus muscle and it needs to be released. So what we do is we take this fine filament needle, we insert it into this top band of tissue, this what most people will call a knot. And what'll happen is the muscle will begin to convulse. It's almost like, imagine like you have a Charlie horse in a muscle.
Yeah.
Now that convulsion that's happening, or that twitch response that's happening, is basically a signal is being sent to the brain to reset that feedback loop that's happening from the brain to the muscle to tell the muscle to relax. So that's in layman's terms. In neurophysiological terms, it's rebooting the acetylcholine at the neurosynaptic junction. So basically, there's like action potentials that are happening, and there's too much acetylcholine that's happening, that's built up, that's causing that action potential to happen, that firing, that overstimulus of the muscle, and this just resets it. So that's one of the theories. The other theory is that it aggregates blood into an area to
Mm.
basically allow the tissue to kind of lengthen. Um, Amongst a few others, I will spare you the details, but the major one that most people believe is the first one that I mentioned, which is that resetting of the sort of the CPU of the muscle.
And if anyone listening hasn't had it done and they get in a situation where it's recommended, I can attest. Um,
It's interesting, Mike, and this is the fascinating thing about this modality. As I mentioned earlier, there's turf wars on it. So because we use an acupuncture needle, many acupuncturists say that we are stepping on their turf because we're using the tool that they use in terms of their profession. So in some states, actually, it's illegal. So for physical therapists to perform this modality, so you can, in the state of California, cannot do it. In the state of Florida, cannot do it. In the state of New York, New Jersey, Washington State, there's like I think 8 or 9 states in this country that have hindered physical therapists from performing this modality because the acupuncture lobby has worked aggressively against the American Physical Therapy Association and has basically deemed it illegal in the Board of Health in those states.
what's wild is that like um, these situations seem to be related to an underlying premise that a person's profession is defined by the tools used. And it's just like I know in California, um, a number like I can't remove someone's tattoo if I know how to do it, because of the type of laser that would be required to do that. But if I go drive to Vegas, like it's less of an issue, right? And I don't know what the laws are today, but if you, I think the exception was you could be a PA or something if you're operating under the supervision, which just maybe means malpractice insurance of some kind of physician, who's cleared to do it, who has a California medical license. And it's weird to me because the job in your case is doctor of physical therapy. Your um, your primary mission has to do with this. Well, you could define it better than I could.
Restoring human movement.
Yeah,
We are doctors of human movement. We want people to move better and move efficiently.
perfect. Thank you for jumping in and saving me on that. I mean, it's um, that's it, and that shouldn't be bound by a tool or not. It should be bound by what the mission is, right? And so the career or the profession, the titling, the qualifications should be able to use what's necessary to accomplish, whatever that goal is. And I think it's um, quite lame.
I mean, listen, there for as far as I remember, there's always been turf wars around what each medical profession can do. For example, chiropractors like to say that they are the only ones that manipulate joints. But osteopaths manipulate joints, physical therapists manipulate joints, athletic trainers manipulate joints. Um, so there was a turf war on that specific issue as well in the allied health professions, so to speak. Um, so it's just the reality of things. Like, we miss the fundamental goal of each profession, which is the patient to
Yeah.
feel better, to move better. And as long as a person is skilled and capable of doing that modality that is being provided, Live and let live, man. If a chiropractor is doing dry needling, or if a chiropractor is giving therapeutic exercise to patients, go for it. Hallelujah. I'm not going to, as a physical therapist, I'm not going to say, hey, you're not allowed to prescribe exercises because you are not a physical therapist. Like, no, go for it.
Taking my business.
Yeah, like it's all about business, all about money in the end, you know? We love to be protective of that which we think is ours.
Well, I can't wait till the hypnotherapists hear about this and you know, get in on all those psychiatrists out there trying to make some kind of impact.
But think about it, life coaching, that's another one,
Oh
right?
yeah.
The
Well,
therapists, the psychologists hate the idea of somebody being a life coach. Like, how dare you go to school for 6 months or do a certification course and think you can do what I do? It's
yeah.
totally different stuff, man. Although, yeah, the people say that it overlaps, but I digress.
You know, life is full of digressions. You know, your major digression, of course, being, you know, your career track. Like, why did you want to get into physical therapy, and at the level that you did? Like, why physical therapy? Why helping people move? What about that beyond just like, okay, seems interesting?
So, for me, the path to physical therapy was all about people. My whole path was, I got injured. I was an athlete. I've been injured a number of times throughout my athletic career. But I was actually on track to be a physician. And then I started to spend a lot of time with physicians, and I realized that they don't actually spend that much time with their patients. It's kind of a very transactional relationship. And that's might be due to the systems in which these physicians operate in. But my experience from that was, it was very transactional, there was no connection that was sort of created with patients. And then I shadowed a few physical therapists, and I was amazed how they were capable of bringing somebody in who was in pain, unhappy, feeling hopeless, feeling this sense of like, man, am I ever going to get through this? And then a few months later, they're on their feet again, doing the things that which they love. It's almost like, I was in my past life, I was a barber, you know, and I was a barber in a New York City barber shop for 7 years. And when somebody would walk in with like a huge fro, and they would look at themselves and be like, man, I'm so sorry, it's been a while since I've come in. And I'd always be like, oh, it's no worry, don't worry about it. But then when you turn the chair, so you have their back to the mirror the whole time, you never want them to see the process, because, you know, when you're cutting their hair, there may be a line in their head, and they get stressed out. So you always turn the person away from the mirror. And then when they finish the haircutting, you'd flip the chair, and they'd be looking at themselves. It was like, oh my gosh, like, you know, Frankenstein walked in, and then, you know, Brad Pitt walked out. There's like a huge transformation that would happen in a person, and the smile that a person would have, due to that sort of transformation, was wonderful.
Yeah.
And I think that's what it's physical therapy is almost the continuity of being a barber. It's Except it's a physical thing. One was more of a cosmetology sort of, you know, exterior. This is more of a physiological, biological manifestation of healing.
Yeah.
And it's cool. It's just a cool. So that was like my real draw to physical therapy. I wanted to help people be better, to be a better version of themselves, to be able to achieve the goals that they wanted to achieve. And it just happened to be the profession in which I found a connection to. I liked sports. I worked with professional athletes early in my career. And now I work with people that have conditions in which they probably will not get better from.
Mm.
So more patients with chronic pain, patients with autoimmune disorders, patients with issues that they won't get better in terms of the medical sense, but they'll be better in terms of being able to do the things that they like to do. So they'll be more functional. They'll be able to enjoy life more. And that's really how my frame of mind has changed about pain and about physical therapy. I get the patients who nobody's given them hope.
Oh,
And
interesting.
that's the type of clientele that I have these days.
Yeah, I mean, there certainly seems to, in both cases, the barbership, you know, or barberhood. I don't know how we might describe it, but you know, being a barber and being a physical therapist, there's a psychological element involved, and it seems like, you know, what you do is you provide um, a certain degree of transformation, you know, or you facilitate. Maybe you're a facilitator of transformation in both cases,
Yeah.
and usually, I mean, well, let's not say usually, but hopefully, it's toward a I don't want to just say positive end, but a restorative end, right? Like, you know, with the matted wild hair, sorry boss, I haven't come in and gotten a cut in a while, you know, versus someone who's injured, or, you know, maybe they're suffering from a debilitation, like you said, if it's autoimmune. um, you know, there's something that's gone off from what was a better previous norm, right? Like where the norm was better, and now something has moved away from that norm,
Hmm.
and now here you are, and you're basically, you're called in this case to help transform that or redirect it toward normal.
Correct.
And you know, one of the things I wanted to ask you about was how, you know, just in talking about pain, because pain's a fascinating subject for me, as you know. And you know, how do we, or how does pain rather um, create parameters for understanding normal? You know, and I'm not the only one. I have a lot of people close to me who have um, you know, experienced debilitating injury, to where now, guess what? Um, this isn't going away. So now what do you do? And how do we understand normal? How does pain, you know, demarcate normal?
Mm. I think there. I think that's a good question, Mike. Um, in my experience, there are two types of patients that encounter pain. There are the patients that encounter pain and their pain becomes the center of their universe, and that is the only thing that they can focus on. And it hinders their mind, it hinders their function, it hinders their relationships, it hinders their whole outlook on life. Um, and there is the other approach, which is I have pain, cool, let's get on with our life. Like, it's not going away. I know it's there, but I acknowledge it and I put it aside. And one can start at sort of that victim person in pain,
Mhm.
and move into what I call the victor, who has basically moved through the pain and it's not a hindrance anymore. Um, and often, sometimes, in rare circumstances, the victor can become the victim again. So those are the two philosophies that I've seen, or the two psychological approaches that I've seen patients come in with. Um, and the ones that, because pain can make you the center of the universe, if you follow me.
Yeah, yeah. Um,
Um, did I lose you at all?
no, no, I'm just thinking, um, and by that, I guess you mean, you know, where the focus is directed. And,
Yeah.
you know, I mean, uh, pain then, like if it becomes, even if it's not a focus, if it's presence, right? Like the presentness of pain is just so evident in the way we experience life, that things like that impact our language. They impact the way we talk about ourselves
Hmm.
to people. I know, you know, there's folks I know who they have mild chronic pains, but now they complain all the time. And, you know, just want to say, listen, I want to value, you know, their experience, and I want to like care, and I want to be caring, and on the positive end, but at the same time, like, I don't want to feed the beast. Like, you know, well, suck it up, let's go. And I suppose there's any number of domains that can be generated through the pain experience, right? And I guess maybe we mean the interpretation of pain.
Hmm. Yeah, yeah. It's interesting, when you get into the idea of chronic pain, we know that, or what they've rebranded it now as not chronic pain, they call it persistent pain.
Hmm.
When you get into the topic of persistent pain, you find that most of those patients that have persistent pain, there is no mechanical cause anymore of that pain. Meaning, we know if a person has a herniated disc, that anywhere from 6 months to a year after the disc herniates, usually it heals. There's a bunch of articles that talk about kind of pre and post timeline herniated discs. Now, a person can re-aggravate it through some sort of movement, and that
Yeah.
can give a new acute version of pain. But some people, when they see their MRIs that say lumbar disc herniation at L4, L5, they define their experience by an image rather than their symptoms, or how they feel dictates how they live. So there's a crazy article that pulled a bunch of people off the street randomly, and they did MRIs on them, and they found that a number of those people, I think it was like 50 or 60% of those people, had pretty terrible MRIs and zero symptoms. And it's fascinating because once you tell somebody there's something wrong with them,
Hmm.
the power of language, you are capable of instilling in them a sense of fear or a sense of hope. And
Hmm.
I find that patients will come in often and say, I have a tear. When you use the word I have a tear to them, they're like, oh my gosh, something is broken, something is ripped. How is that tear going to heal? Versus if you say, you have a minor injury in your back and it's going to heal. They're like, oh, okay, that's fine. So the language that a doctor or a healthcare professional uses can manifest a psychological response in a patient that either moves them to believe that they're going to get better or moves them to believe that they're going to get worse. So language matters, and the language that healthcare workers use elicit a sense of hopelessness or hopefulness in the patient. So I drill in my staff, be careful with language. Language has a huge bearing on the patient. Careful not to catastrophize, because if you catastrophize, the patient will get worse. But if you instill hope in them, I promise you the power of the mind is capable of making that person's MRI, which is terrible in medical terms, actually not manifest symptoms that are terrible. If that
Right.
makes sense.
Yeah, absolutely. Um, it seems to me that I don't know if I want to call it liturgical or not, but there's like part of the healing process, right? One responds to the condition, let's say the pain, and we'll use the MRI, whatever the condition is. They come in by entering into your office. The healing process has begun by seeing you, right, or by seeing the doctor. Now they've gotten connected to the expert in the case, and this person should, or at least in the mind of the patient, they wouldn't be going to that person if the person didn't know, how to address the issue,
Mm-hmm.
or at least, I mean, address doesn't always mean fix. So address is good. How to address the issue, and um, what we say in that ritualized process of entry from one layer of the lobby to the exam room, right? Like every step closer is a step closer toward real healing, right? But what's spoken matters, because what's spoken is the way in which that person understands themselves now through the eyes of another. I mean, it's my interpretation of it, but I know that I've dealt with a lot of. I'll apply this more to physicians, but people who have really poor bedside manner and really good bedside manner, and they may misperceive their own craft as something that is a set of qualifications and certifications rather than a mark of identity, maybe. And those awesome doctors that we've had over the years are the ones that know how to speak a healing word, and the terrible ones, and there's terrible doctors. Let me be quite frank. In
Amen.
the the figures I'm giving apply to all fields, not just medicine.
Yeah.
But let's divide it three ways. Maybe it's not 33.3 for each group, but there are the excellent, the people who are called to do it. They like that's what they need to be doing. There's people who are good enough. They're not bad. They get the job done. And then there's people who you wonder, how did you even get involved in this? And can you just leave? Can you be somewhere else? And I think that not enough attention's paid to bedside manner and to speaking the right way. And because it's how we imagine the condition, as
Yeah.
you've said. Um, the question I have for you is, can we do something about this at the level of development, right? Like if we've got kids, let's say, and dads and moms, and look, I'm generalizing, I don't care, I'm just going to generalize right now, but kid falls, you wink at the kid and say, come on, let's go, not fast enough, right? Or shake it off, maybe as a step down, because then it acknowledges the pain event, right, that happened. But if it's ignored, it's one thing. If it's, shake it off, it's acknowledging it, but toughening up to it. Or do we run, as some parents do, grab the child and say, I care so deeply, which we do, right? I mean, I hope. But, how are we setting a young human up for developing the way in which that human is going to interface with pain events throughout life? And I haven't really thought about it until this conversation, but because I typically think about it in terms of language and perception.
You know what I do with my kids is anytime one of my kids falls, I never say it's okay. I always kneel down at their level and I say, did that hurt? So acknowledge that I see that something hurt them, and then I say, would you like a hug? So that like I'm basically there in the midst of their pain. Like I'm not trying to get them to not acknowledge their pain. I'm not trying to discount their pain. I'm trying to be there with them in their pain and trying to give them the comfort necessary to be able to get up on their feet and keep on going. And I kind of liken that to what I do every day with patients, right? Like these patients are coming in and they're experiencing pain, and I'm not saying it's okay. I say, I hear you. Your pain is real. You're experiencing it as real. I want to be here to walk with you through that pain and get that pain to no longer be a hindrance for you to live life in the way that you want to live it. So I think you see the power in parents to really empathize with their children and allow them to be empathetic by proxy.
Mm-hmm.
Like I'm seeing my daughter now when she sees my son, they're twins. When she falls, she'll come and she'll rub him on the back and say, hug, hug. So I'm seeing how now she's modeling what we do with her to her brother. And that's beautiful because she's now seeing her brother in pain and sort of responding to that pain in a way that is so beautiful.
Yeah.
So I think that's like you caught me on the fly on that, but I do want to say something about the power of parents.
Yeah.
In their ability to also instill in their children in a sense of to be jerks, you know, um, or to be so insecure and have no confidence in themselves and now have no ability to navigate struggle.
Mhm.
Like if you have a parent that coddles their kid, the kid when they experience pain doesn't know how to cope. When you have a parent that discounts every experience that a kid has, the kid becomes sort of desensitized. So yeah, I mean, I think we all are a product of our parents in a way. The most influential relationships that all humans have is with their caregivers.
I've seen, um, you know, certain similar injuries in different contexts. Like with one parent, the child will be quiet, and with, let's say, a grandparent, the child will bawl for hours. Uh, when the grandparent leaves, the crying stops, and so I think the way we respond to it, it certainly it affects behavior, um, without a doubt. But then, I'm curious to see how, like, over a life course perspective, how that impacts. Let's say, I don't want to discount anything, but call it real injuries,
Hmm.
that happen throughout life. And how do we measure pain, right? Like, is pain conditional? Is it something that, okay, you and I, at some point in our lives, were athletic. You still might be, you know. Okay, well, maybe I might be too, but um,
We're halfway athletes. Halfway athletes.
yeah, we have one foot out the door,
That's right. That's
one
right.
foot, one knee, one hip, several other joints, part of that out the door. But when you're an athlete, you train and you work against resistance, and part of that resistance could be interpreted with the word pain. I mean, even like, what do we mean when we say the word, right? And I think, um, what's the difference between work and toil, for example? The work that bothers you. And so what's really painful and what's annoying, and I think that might be conditional. That may be something we can, um, reevaluate or recalibrate. Do you notice that with your patients, that they find that their pain isn't always the same, or maybe they've grown, call it stronger? I mean, you have a better term, but they deal with it in a different way, maybe,
You know when people feel the most pain, Mike?
when no one listens.
Take a guess. When is people's pain magnified?
Oh, golly.
Yes.
When they're around people,
Nope.
when they're alone.
When they're alone.
Yeah.
At night, when it's dark, there's
Uh-huh.
no outside stimulus. It's just them in bed looking up at a ceiling, and that's when people's pain is often the worst.
Interesting.
There's
So
no distractions.
they dialoguing with the pain.
Yeah. Oh, my right hip hurts. Oh, like you can almost personify it. When you're by yourself, there's no way to distract yourself. Actually, modern pain science is talking about how to distract yourself from pain. You
Oh,
know.
interesting. I mean, so that if one distracts from pain, they're making the assumption that pain is um a thing apart from the emotional, connection to the sensation, right?
Yes. So we call that sensitization. So when a person, for example, has an itch, you
Hmm.
ever notice this? And then that itch, they scratch it. There is this awareness now that there's something that was itched, there was something that was scratched, and then you keep on scratching. And then you break the skin, and now you have a cut. And now that cut is now an actual injury that
Right.
now sends a feedback loop to the brain again. So you've now oversensitized that itch and made it actually something painful.
Hmm.
So by focusing on it more and more, you've actually magnified it. That's why some people with chronic pain or persistent pain, what feels as a pinch
Hmm.
to you and I feels like somebody stabbing them.
Mm.
It's It's not that the pain isn't real. What they're feeling is literally real, that somebody's stabbing them. But it's not because the external stimulus should cause that manifestation of pain. It's that they are oversensitized to it. So that feedback loop that's going through that brain to that specific area is just like high alert, high alert, high alert. So yeah, you can desensitize to pain, and that's the whole thing. That's the whole approach to modern pain science, is desensitization, figuring out how to distract a person from their stimulus, so to speak.
Hmm. I'm thinking about, some folks who, maybe they were less active or athletic, let's say, and, one day they have to shovel snow, and they're just not used to doing that. And then they're laid up in bed for 3 days,
Yep.
can't move. But that's not just, something located in the interpretation. There's, those muscles haven't been used,
Correct.
and on the opposite end, the people who are used to shoveling snow frequently, they have a conditioned response in terms of their muscularity that prepares them to deal with the event,
Of
which
course.
thus doesn't cause pain, right?
The Navy SEAL who gets
Yeah.
thrown in sub freezing wet temperatures on a beach to condition them to tolerate terrible conditions in war, you know? Or the person who's thrown in the water and forced to hold his breath. He conditions himself to be able to sustain long periods of time without oxygen. The marathon runner who starts with 1 mile and then ends up, running a marathon, 2 marathons, an ultra marathon. How do they get to that point? There is a conditioning that happens, and it's through ongoing exposure that allows them to get more conditioned, to your point.
Could we then say that pain? So you talked about pain earlier as, the two types of folks, the people who kind of shrug it off or say it's there, let's deal with it, let's, figure it out. And then others, oh, they're too engaged in their pain, and for them it's persistently chronic. Oh, I used both terms. Um, is there a third category, the masochist or the masochris, as we're calling you now, um, who uses
Who like
pain
pain?
to be transformative, right? Because if pain keeps getting redefined, if pain then is it's an alert, right? If you and I've understood this at least from high school sports, that it's an alarm, like an alarm clock, and it's letting you know something's happening. And you can deal with your alarm clock all sorts of ways. You can try and maybe ignore it, but you still got to get your task done. And then pretty soon you don't consciously acknowledge it, and then maybe that becomes normal. Maybe other noises start going off in your household, and you transcend them, right? They become a part of the norm redefined. Or maybe the thing breaks because it's been going off, and I don't know, the metaphor's breaking
Yeah.
down here,
No,
but
no, I hear you. I hear you. Yeah, I think there are some people who can be conditioned by pain, for sure. Somebody who's had a major procedure before, if they have to have another procedure, they're more prepared for it. Um, I think for sure that's a fact, right? Like a person who, like, for example, I used to competitively lift weights when I was in high school. And I know the feeling very strongly of what it feels like to be really, really sore. Like when you can't lift your arms, you can't get up out of bed because your core is so exhausted. You're so sore. I know that type of experience because of prior experience. So now when I go to the gym, when I'm like an old, rag, and I'm trying to walk into the gym and I work out pretty aggressively because I think I'm still my high school self, and the next day I can't walk, I don't think that I've injured myself. I know that that's what we call delayed onset muscle soreness. I know that from prior experience. That prior experience of pain has given me the understanding of what the current experience is. So yeah, there are some people that helps their pain is a precursor for their future pains ease, so to speak.
No, I like that. And I think that, especially in sports, you get this opportunity to transcend, you know, um, limits, boundaries, standards, and you create new limits, boundaries, standards with regard to things like that. And pain's a useful tool for that. Pain, at least the way I played contact sports growing up, and so it pain for me was a way of measuring progress, and
No pain, no gain.
well, and if you don't hit that point of pain too, like, and you're not the best on the team or the best in the league, something's off, right? Like you haven't pushed further than you need to, right? Or you haven't gone to the extent you need to prepare yourself, to condition yourself for the events. And I think that it's translatable to, beyond athletics, right? Like, we talked about spirituality and stuff, and there's all sorts of examples of people who they utilize pain for a different sort of awareness. And there's I know of clergy like in the monastic life who wear sackcloth, underneath their clothes. And if you felt like burlap or sack, um, it's not pleasant. It's definitely not silk, it's not satin, it's not even cotton, right? Like it's what, 50 grit sandpaper. It, but you use that and all of a sudden, um, your discomfort becomes your new level of awareness. And maybe it's not a comfort, but maybe the awareness of it drives you towards something else, mentally. And in that process, there could be comfort in the process, maybe not in what's happening, at the physical level.
Yeah, yeah, yeah. I like that because I think pain is a beautiful thing, right? Like I have some persistent pain.
Yeah.
I have a number of herniated discs in my back, and first of all, that pain lets me know that I'm alive.
I mean,
Second of all, that pain makes me uniquely capable to empathize with those who have pain
yeah.
and to sympathize with those who have pain. Third, that pain is almost like, back to that analogy with working out, right? When I don't get sore, I know that I didn't work out. When my back doesn't hurt, I know I haven't had a physically rigorous day. It's almost like that back pain has to manifest in order for me to know that I've had like a day in which, like last week in the Orthodox Church, it was Holy Week. And I was standing for many hours during different services at church. And by the end of each day, I was like, oh, like I felt like a 98-year-old man with my back.
Yeah.
But it was like, yes, I stood, I prayed. Like I felt like you felt the outcome of the day in your body.
I heard I heard someone actually, post something online, referring to those, as orthodox burpees, because there's so many prostrations for those listening who aren't from that tradition. Like, during these services, people go from a standing position, down to the ground to a bowing position. They push up with their arms and go stand again. And this is repeated numerous times and different days. Like you're doing it all day in some on
That's why
Friday,
he's
right?
got big pecs and big triceps, you know? Huge.
Well, my response is like, I know a lot of bishops with some thick quads, you
That's
know,
right.
from all of this activity. But yeah, I feel the same way. Like I don't feel like I've been productive if I find myself justifying the workout by like, well, okay, I'm at least keeping my circulation up. I'm working on a routine. Check those boxes. Like I've done something mildly productive, but I haven't advanced. And I think pain um, is great in that regard. And sometimes when we talk about pain, we're misunderstood as talking about suffering, right? Like, and that might be applicable to those with the persistent pain or the chronic pain you talked about earlier. But even beyond that, you know, emotions, things like that. There's an interpretation of pain that is redefined, and we call it what? Suffering. And I think that that almost, and I'd love to hear your feedback on this, but it seems like it leaves the domain of the physician, the physical therapist, and enters the realm of the psychologist and psychiatrist, who's also a physician. But
Yeah.
it seems to move that direction.
Yeah. Yeah, for sure. You can have pain and not suffer,
Right.
for sure. It goes back to what I said earlier. Some people's pain becomes the center of their universe.
Mm-hmm.
And when it becomes their center of their universe, they suffer because they cannot live fulfilled life. They cannot live a life in which they feel like they have something to contribute. Because it becomes very self-centered pain. And that pain leads to suffering, like,
Yeah.
because their world is disoriented. Their world is, they don't feel whole. They don't feel like they are the version of what they should be.
Mm-hmm. Right.
So by proxy, when you don't feel whole, when you don't feel like you are the best version of yourself, you are incapable of interacting with the world around you in a way that you experience the joys that life has to offer, so to speak. And I think also, it's interesting, I'll tell you a story, Mike, that you brought to mind right now. There was, when I was in Kenya in 2007, doing a medical missionary trip, I remember walking in Nairobi,
Mm-hmm.
and I was wearing these nice pair of Nike sneakers, and all of a sudden I stepped into this like pit of mud, and this little kid who was just one of the street children in Kenya said, "Sir, let me have your shoe, I'll go wash it for you." So I gave him my shoes, and I'm walking on the streets of Kenya with socks, and my feet were killing me, Mike, like killing me, because these are pebbled streets. It's not like they're paved.
Right.
I didn't and my whole focus in that moment was how annoyed I was that I stepped into this muddy hole, and how my sneakers got messed up, and how much my feet hurt. My experience was the center of the universe in that moment.
Mm.
And this kid wasn't wearing shoes, and he ran barefoot to wash my shoes and then brought them back to me. And I noticed when he came back that his feet were bloody. He didn't even flinch. Here I was, the guy who had socks on, the guy who has walked for all this period of time with nice Nikes on, and here is this street kid who's not wearing shoes. And actually a lot of the kids will wear bottles on their feet strapped with some sort of straw. But they've conditioned themselves, and when they get those type of shoes, they're like, oh my gosh, a bottle, wow, this is amazing. I made my painful experience the center of my universe, that I was incapable of seeing this little kid who didn't even have shoes on. And that's what in that moment I experienced pain, but I suffered as a result of being incapable of seeing the world around me with the lens that I should have seen it with. This kid has pain in his feet. Literally, he has a mechanical manifestation of pain, which blood on his feet, but he is willing to run and wash my shoes so that I don't encounter pain. And man, that is the victor, and I am the victim. That is, the kid is a baller, and
Yeah.
I'm this loser who is like incapable of seeing the world the way it should be seen. And this kid is happier than I am, and I'm the Westerner with all this money. But this kid lives on the street, and he's experiencing joy because he was able to bring a little bit of hope to me in that moment. And I'll never
Oh,
forget
I
that.
like that. That's
I'll
awesome.
never forget that moment.
It reminds me of all the football players down in American Samoa who are like they have old equipment if they have any working equipment, often don't have proper footwear, and they play on fields that barely have any vegetation or have lava rocks, and you get tackled and like that's the norm, right? And so uh, as you're talking, I'm wondering, is softness suffering? But at the same time, maybe in some cases softness is suffering. But then I think, okay, you also treat a number of people with autoimmune issues, maybe things like rheumatoid arthritis. That's a popular one that I'm familiar with. And in those cases where you don't choose the pain, right, where you can't choose to go up a hill, to go run on pebbles and through you know um, barbed what thistle, or whatever the plants are that stick in our feet, right? Like if you can't choose that, um, can you somehow reinterpret the suffering so that you just acknowledge the pain? And you know in your case, as
Yeah.
someone who treats that, what do you do?
I uh, I have a patient who I can speak about. I'm not going to disclose any HIPAA violations here. So I have a patient of mine who has. I see her for 2 hours every week. One session, 2 hours ongoing. And this woman, her medical file is probably this thick with different diagnoses. She doesn't have one autoimmune, she has like seven. And this woman is the most empathetic, selfless, giving, kind person that I've encountered. She always goes beyond herself to help others. So yeah, she has the physical manifestation of pain on a regular basis. She experiences a lot of pain to the point that she has difficulty getting out of bed most days.
Yeah.
But she is the most joyful person. So she hasn't let herself suffer as a result of her pain. She's let herself constantly go beyond herself to help other people. And that's actually one of the ways we encourage people to overcome their own pain. We tell them, go do something for someone,
Mm-hmm.
right? Because we know even in the study of happiness, right, there is actually happiness is an area of study for people. They say that there are three things that scientists have studied that have produced happier outcomes in people, right? The number one is deep and meaningful relationships. The number two is acts of service, giving of yourself to others. And number three is gratitude.
Hmm.
People that practice those three things lead more happy and fulfilled lives. So that's what we encourage people in chronic pain or persistent pain to do, to figure out how they can invite, not really invite, to figure out how they can extend themselves in deep and meaningful relationships, even in the midst of their pain. We figure out how they can serve others by extending themselves to others, and how they can find the good in life, even in the midst of the pain.
Is it then worthwhile to um well, this is ridiculous for me to say it this way, but to like, create a happy environment in life, which we should do anyway, right? But if if someone, maybe let's start with someone close to us, friend or family, is someone who is suffering, is it good to create a jovial, uh, positive environment? Because it seems like as you're talking, I'm thinking, okay, well, if I'm in pain and everyone is, yelling, screaming, upset, or like there's a lot of negative input, um, it seems that what you described in that case that you mentioned was maybe that person's around some kind of positive environment, and maybe that positive feedback and those positive inputs are actually, you know um, turning off, those suffering alarms emerging from the pain sensation that is present.
Stress, we know, is a huge input for pain.
Yeah.
There's actually an amazing documentary from the National Geographic that came out years ago. It's called Stress: The Portrait of a Killer.
Wow, I like it.
And it talks about how, as animals, like when a zebra is about to be attacked by a lion, stress is a positive thing. You
Yeah.
know, the fight or flight response of the zebra kicks in to protect itself, a self-preservation mode, because they're about to be eaten by a lion. But humans constantly live in that fight or flight response, and what that fight or flight response does is manifest in pathology. So
Mm.
yes, for sure, this the environment in which we put ourselves, whether it be positive or negative, has an impact on our experience, right? Psychologically, physiologically, musculoskeletally. There's just so much. We know that stress is terrible, but we know that being in an environment in which you are uplifted and encouraged is wonderful. And it's
Yeah.
great for people. That's why support groups are helpful, for people in pain and for different diagnoses, autoimmune diseases, because they have somebody there in relationships in which can lift them up and push them to a place in which they are no longer making themselves the center of the world.
I love that. That's it even makes me a little self-reflective too, and mostly in the sense of n- maybe not for pain, but being, when something is the focus of who and what you are, at least in the moment, right? For you, your shoes, the annoyance, um, and when you focus on things like that, it seems to take away the experiences, the others around you, and maybe through that, opportunities for empathy. And I think, okay, well, if there's people, and you often, we don't know, right? We don't know who's in pain unless it's glaringly obvious. Like, I know, I mean, there's some people you look at, okay, well, that person's, I can see their legs, I can see the way they walk. You don't walk that way unless something hurts, right? But a lot of other people, you just don't know. I mean, people may not, when they encounter you or me, they may not know our conditions, and what that plays into how we talk, right? And maybe we mask it well, with our beautiful smiles, right? And charming personalities, the tears of the clown, so to speak. No, that's too much. That's too much. But just thinking about myself, like, I don't know the other person, and I don't know what that experience is, and what a nice thing it could be if I'm, creating at least a cloud around me of something positive and happy.
For sure. I would even, for those who are listening, I would even also take that one step further. In There are many people, you're right, that walk around with invisible illnesses and pain. Um, we don't know what people are carrying. We don't know what type of suffering they are encountering on a regular basis. I'll give you a perfect story of that happened to me last week. One of my patients, who is the sweetest, nicest, kindest person, I love this guy. He walked in Um, and he was like so rude. Like I've never, he was like being rude to my office manager, just was like in a bad mood. And I'm like, what is going on with this guy? Like, what's his deal? He walks out, he ends up leaving the office, he slams the door, he's just being like a total jerk. Find out he just got a diagnosis of prostate cancer. And he was really worked up that day because his fear was manifesting in a lot of psychological pain for him. And when I learned that, I mean, I gave the guy the benefit of the doubt in that moment because I know his character. But most of us in society have lost the ability to give people the benefit of the doubt.
Mm.
And we've lost the ability to take a step back and say maybe that person is going through something. Not saying we excuse people's behavior. Like being in pain doesn't mean that I'm entitled to be a jerk. But I think giving a person the benefit of the doubt in a moment will often lead to you also being more fulfilled and happy, and you not experiencing pain as a result of somebody else's outburst. Meaning, if I encounter somebody who's a total jerk, oftentimes that experience with that jerk can lead to me experiencing pain in some capacity. Do you know what I'm saying?
Yeah, right, right.
So if I encounter that person and that doesn't really faze me because I'm like, oh, maybe that person is going through a hard time, you know, or maybe that person got a diagnosis of prostate cancer. Just giving the person the benefit of the doubt, it leads me to not letting that person control how I live on a day-to-day basis.
Yeah, you're not a victim of that person's moment.
We let people control our emotions and our how many people come home? You would never believe what happened to me today at the supermarket. The person who was putting my groceries in the bag was such a we hold these encounters as things that allow us to not have pain but to suffer, because it becomes a ongoing experience that we repeat. It's not the moment, it's the thereafter of the moment.
I have that exact set of experiences. And in fact, when we were living in Baltimore, there was a woman who, I forget if she was a security guard or what she was doing, but she, you know, was miserably not herself and unpleasant. And, come to find out, I think it was her nephew who was murdered,
Oh, wow.
the just before that. And it's like, after that moment, I started to see that person's experience in a lot of the people who, like at the grocery store, right? The problematic giant employees, or whoever they are. And it it's something to it's something to think about, something to be conscious of, something to, almost, if I don't know if you're for daily affirmations or things like that, but to be aware of on a daily basis. And when people give thanks, if they do, if you don't, you should give thanks. And when you do, be mindful of those who aren't you. Be mindful of call them the other, call them your neighbor, whatever it is. Man, I had a great chat with you. Any final thoughts for us? And if there's anything you'd like to plug, this is your time.
um, hmm. I think what I would love for people to walk away from this conversation is you are in control of how you experience the things that life throw at you. Meaning, life will bring hardship, life will bring pain, life will bring circumstances in which you have the choice to either choose joy or to choose suffering. And the beauty is that pain often produces thicker skin. So there's a beauty in pain. There's a beauty in trial. There's a beauty in hardship. In our society, we have ran away from that but I firmly believe that those who have suffered are uniquely sympathetic and empathetic to a world in which we desperately need more empathy and more sympathy. So I would just encourage people, like, hey, from a physical therapist to the world out there, pain is not your worst enemy. It could be a catalyst for your growth as a human. Um, and finally, if you are interested in a podcast, I, with a dear friend of mine, host a podcast called the Reintroduction Podcast. And it's a podcast that has a more spiritual undertone, that talks about the misconceptions that people have about God and about one another. So feel free to check that out. We're on season 2 and we're about to wrap it up and hit season 3. Feel free to check it out and shoot me a comment or let us know how you like it. But Mike, thank you so much for having me this afternoon. I've really enjoyed being on with you. I hope that I said something that was productive.
All I know is, we got to go get after it. Next time I see you, I'll be out there in September, and we're gonna hit a few hills and
There we go, man. Ready. Bring it, baby.
throw up some barbells while we're at it. All right, brother. Take care.
Thank you,
Appreciate
Mike.
you. Love you. Take care. See everybody.